Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up health. CDC's out vaccine chief resigned, saying, quote, "Enough is enough," end quote. Longtime community leader and LGBTQ health director of the CDC's Center for Immunization and Respiratory Diseases, Dr. Dimitri Daskalakis, has resigned, citing irreconcilable ethical and scientific concerns in a resignation post on both Twitter and Instagram, calling out HHS Secretary Robert F. Kennedy Jr. He wrote, quote, "If I am unable to serve in an environment that treats CDC as a fool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health, I find that the views he and his staff have shared challenge my ability to continue in my current role at the agency and in the service of the health of the American people. Enough is enough," end quote. This resignation followed changes to COVID-19 vaccine approval updates from the FDA that made the vaccines almost exclusively available to seniors and those with underlying health conditions. The American Academy of Pediatrics has warned that the move could undermine vaccine confidence and leave children unprotected during the surge of seasonal respiratory illnesses. I think it's very interesting. I think there's a bigger story to be told here, and I'm sure we'll see more and more of this coming out. But on top of his resignation, there have been 4 other very large individuals, doctors that were at the CDC that has resigned. Dr. Susan Maneras, who was the former CDC director, her background of federal government scientist, Maneras was confirmed by the Senate in July 2025 and sworn in as CDC director on July 31st. On her departure, she left the agency less than a month into her role. Her exit followed a shooting at CDC headquarters and increased political pressure from the Trump administration and HHS Secretary Robert F. Kennedy Jr. And then we had Dr. Deborah Howery, who is the chief medical officer. Her background in emergency medicine physician, hourly led efforts on opioid overdose, mental health, and injury prevention. Departure was due to her resign due to proposed budget cuts and misinformation undermining CDC's mission. And the other one, Dr. Daniel Jernigan, Director, National Center for Emergency and Zoonotic Infectious Diseases background, a 30-year CDC veteran and the top flu expert. Jernigan worked on responses to Ebola, Legionnaire's disease, and flu pandemics. His departure was cited the current political climate and restructuring as reasons for stepping down.